get you to this moment
Is that it?
Yeah, that's it.
of relief,
Awesome, I think.
protection,
Just got vaccinated.
I just got vaccinated.
No, just got vaccinated.
hope, so that we can get to all the other moments. Let's get you to the exhale you didn't know you were waiting for. Let's get it together so we can be together. Let's get to immunity. Now's your moment to get vaccinated.
Estamos tan cerca de vencer a la pandemia, tan cerca de aclarar tus dudas, porque sabemos que la vacuna será un gran alivio para ti y toda tu familia.
Nos vacunamos por nuestra familia.
Yo me vacuné por mis papás.
Estamos muy cerca de volver a estar cerca. Y para lograrlo, llegó el momento de planear cuándo te podrás poner la vacuna contra el COVID-19. Logremos vencer a la pandemia. Logremos la inmunidad.
Get it for hugs. Get it for haircuts. For birthdays and birthday cakes. For family photos and dreams come true. Get it for holding hands, live shows, and movie magic. Get it for prom night and slow dances. For drinks, dessert, and everything in between. For the friends who become family. Get it for big swings, big adventures, and the biggest days of your life.
Póntela por los abrazos. Póntela por los cortes de cabello, por los cumpleaños y los pasteles, por las fotos con la familia y por los sueños que se hacen realidad. Póntela para reconectarte con tus seres queridos, por los conciertos en vivo y por la magia del cine. Póntela por las quinceañeras y los bailes románticos, por los brindis, el postre y todo lo demás. Por los amigos que se convierten en familia. Póntela por los partidos emocionantes, por las grandes aventuras y por los días más importantes de tu vida.
Ladies and gentlemen, welcome to the COVID vaccines toward the new normal and advancing economic recovery webinar in partnership with the California Department of Public Health Vaccinate All 58 campaign and Blue Shield of California. Before we begin, here are some housekeeping items. Please utilize the Q&A function on the bottom of your screen to submit questions to the speakers and panelists if time permits. The session will have live simultaneous interpretation in Spanish. To access this feature, please select the interpretation icon at the bottom of your screen and select Spanish. For individuals who are tuning in from a mobile device, please email your questions to info@cahcc.com. If you have any technical questions, please call 916-444-2221 or email info@cahcc.com. Now, please welcome to the webinar stage the California Hispanic Chambers of Commerce President and CEO, Julian Cañete.
Good morning, everybody, and thank you to all of our chamber leaders and community leaders who are joining us this morning for COVID-19 vaccines toward the new normal and advancing economic recovery webinar. And I also want to thank our partners this morning, Blue Shield of California and California Department of Public Health, for all their assistance in putting this together, and their partnership for many more of these webinars to come in the coming weeks. The state and their partners are mobilizing at every level to proactively and aggressively protect the health and well-being of Californians and our economy, but they cannot fight this outbreak alone. We need the participation and support of every Californian and of all of our community leaders. That is why we're providing up-to-date, relevant, and reliable sources of information. Californians who are vaccinated or not need to know how critical it is to learn how to stay healthy and how to educate and help others on the real facts about the vaccine and where they can get more information and reliable sources of information. These actions are critical, and there is no doubt that our collective efforts will save lives, help California open fully, and help our economy to recover. Our panel's focus will be to address and dispel rumors about COVID-19 vaccine and to address your questions, to address any questions that you may have. I would like to take this time now to introduce our panelists for this morning. First, I would like to introduce Sonia Harris. She is the Senior Advisor of the COVID-19 Vaccine Task Force for the California Department of Public Health. She leads California's outreach and education campaign, and she is charged with coordinating across the Department of Public Health and Department of Social Services and Labor and Workforce Development Agency and other state agencies to ensure all Californians, especially those disproportionately affected by the pandemic, are educated, motivated, and activated to get vaccinated. Next, please welcome Dr. Cruz, MD, Senior Medical Director of Blue Shield of California Promise Health Plan. Prior to his arrival at Blue Shield of California, he was a principal for Health Management Associates, a national healthcare policy firm which provides consultation services to healthcare systems, hospitals, medical groups, and state agencies to help them address the needs of low-income and vulnerable communities. Dr. Cruz graduated from UC San Diego School of Medicine and Family Practice Residency Program at White Medical Center in Los Angeles. He is a board-certified family physician. And our third panelist, Dr. Ilan Shapiro. Dr. Shapiro was born and raised in Mexico City. After graduating as honorary valedictorian from medical school, he began working for the Mexican Secretary of Health as the liaison between Mexico and the World Health Organization, WHO. And he followed this by his pediatric residency at Mount Sinai's Children's Hospital in Chicago, a community hospital serving and advocating for minorities and less privileged. On the international arena, Dr. Shapiro has had the honor to be elected to the first advisory in conjunction with the Foreign Ministry and the Mexican Health Ministry for the binational program Ventanillas de Salud, a federal program that devotes its effort to the well-being of Mexicans abroad. Thank you to all our panelists for joining us today, and welcome. So I want to get started, and our first question I'll throw over to Sonia, Senior Advisor for the COVID Vaccine Task Force here in California and for the California Department of Public Health. So Sonia, I wanted you to expand a little bit on the role of the California Department of Public Health and the campaign to vaccinate 58.
Yeah, thank you so much, first, Julian, for creating the space with the statewide chamber to have this discussion. We recognize not only at the department, but at the campaign, really the value of you all as our trusted messengers. And so, just again, so much gratitude for creating this space this morning. So the role of the department and the campaign, I'll start with the department. I had a chance to join the team early this year, and I have to say, I have not seen public servants so dedicated to making sure Californians are safe. The work that has been put in, since early last year around keeping Californians not only up to date, but making sure, that the pandemic response was led with science and common sense, is something that I'm so grateful for them for. And as I mentioned, joining early this year, really building on the foundation of our outreach and education campaign and bringing it forward and amplifying it. So our campaign is a statewide effort that combines some of our best practices from the census in reaching those that are hardest to reach. We're targeting, a quarter of Californians, those that are in the least healthy areas as we define them through our vaccine equity metric, really to make sure that we empower those Californians with facts and, really trying to get to the root of what are their questions, right? This vaccine process at sort of face value appears to be very quick, though science has helped us over the last decade to be ready for these moments that were presented to us. But, we've still got a lot of misinformation to overcome, communities that are busy still responding to the pandemic actively, but trying to resume normality. So making sure that we're reaching Californians with trusted messages through trusted messengers. So look forward to sharing more about the campaign as we continue the conversation.
Well, great, and thank you. And thank you for all the good work you're doing, Sonia, and making sure that the CHEC partnered with the Department of Public Health. We appreciate that outreach. Now to Dr. Cruz and Dr. Shapiro. I guess in plain English for everybody, in terms that they can understand. I know you're both good at this because I've worked with you guys before and have heard you guys speak. How does the vaccine work, and why is it so important for our communities to get vaccinated? And Dr. Cruz or Shapiro, whichever one wants to go first.
Well, good morning, Julian, and I want to thank the Chamber for inviting Blue Shield of California Promise Health Plan and myself to join the panel this morning. And I'll answer your second question first, is why is this vaccine so important to our community? Tragically, the Hispanic community has been disproportionately impacted by COVID-19. Statewide, by a wide margin, the Hispanic community has experienced the highest rates of infections, hospitalizations, and deaths. So that goes to show how important it is for the Hispanic community to get vaccinated. How the vaccine works, how the three vaccines work that we have right now, the Pfizer, Moderna, and Johnson & Johnson vaccine, is actually quite simple. Vaccines, when they're given to us, they rev up our immune system. Our immune system produces antibodies, very specific, that go out, identify in our body where the virus is located, and destroys it, so that we are able to resume our normal activities and be safe from the vaccine infection. Maybe Dr. Shapiro or Sonia, if they want to discuss the more technical aspects, I'll happy to have them discuss that. But that essentially, that's how the vaccines work.
And Julian, one of the interesting parts of the vaccine, because a lot of people go like, well, you're talking about antibodies. I already got COVID-19. Why do I actually need again to be vaccinated? Well, there's a couple of interesting things. Or the other way around, you're like, I'm hearing that this is just like the flu and it will be mild. And those are things that are hurting our communities. And let me tell you why. At the moment that, yes, we need the antibodies, but there's two ways to do it. One, yes, you can get COVID-19. That's the natural way. And first you need to survive. That's, key important thing. After surviving, you do not need to have like chronic problems that, like we're seeing right now, more of the chronic callers that are using oxygen. needing lung transplants, memory loss, heart arrhythmias, liver problems, and so many, and clothing factors, thrombosis, and other horrible things that COVID-19, the disease, is actually doing to them, then imagine that you pass all that stuff. On reality, right now, we do not know how long the natural immunity lasts for. Then we do not know how long we're actually going to be protected or not. Then the other way around is that you can actually get the vaccine. With the vaccine, Dr. Cruz said it perfectly well. We're training our immune system how to create that antibodies in a smart way to defend ourselves and the people around us. That's the other important thing. And well, you have that part. And do we have a part of our body that will react to the vaccine? Yes, that's the learning factor of it. I hate that we call it actually side effects. We should supposed to be calling it like learning capacity of our body, the fever, the pain on the arm. That's all things that your body is actually reacting to it. And let me tell you something, Julian, that a lot of my patients actually share this with me. They would prefer to get, and people that actually already had COVID-19, the disease, they would prefer to get a vaccine every day of their lives instead of having 1 hour of the horrible feelings that they have for COVID-19. Then that's kind of the perspective of why it's so important, the antibodies on the vaccination part of it, rather than the natural weight of it.
You made a good point. I've heard a lot of people saying, well, I had COVID already, and it wasn't serious or slight or whatever, but they say I had COVID, so I don't need to get the vaccine. Is that true or not? I mean, and kind of expand on that, Dr. Cruz and Dr. Shapiro. Big X there.
Yeah, well, the answer is, as Dr. Shapiro just said, is you still need to be vaccinated. When an individual is infected by COVID and they have all the symptoms and they recover, thankfully they recover, our body produces antibodies against that virus for just a short period of time. We really don't develop a long period of immunity. The vaccines allow our body to develop a very strong and prolonged response against the virus, so it protects us for a much longer period of time. And that's why it's so important for our community to get vaccinated and not wait.
Dr. Shapiro, anything to add to that?
We're good.
There's as we talk about, a lot of the disadvantages communities out there and communities color, making sure they have access or gain access to the vaccine. And I know, both Dr. Shapiro and Dr. Cruz, you guys have, worked in disadvantaged communities as doctors and providing them services. And I know Sonia has worked in this area with the census and other areas of making sure we're communicating with the disadvantaged communities. How can we best alleviate their concerns and ensure that they all have access or are able to gain access to be vaccinated and to the information? And we can start with Sonia first. Sonia.
Yeah.
She's down.
Of course. So I think that there's a couple different ways that we can approach this. First is sort of systematically, right? The state has really prioritized equity as our North Star. And what that means is really focusing in on those that have the most barriers to overcome and getting the vaccine. So several months ago, we did have the opportunity to partner with a third-party administrator, Blue Shield of California, who's helping us really look at, what does that provider network, across all of California, when we look at the federal programs through the pharmacies that are offering services, when we look at, independent family practitioners or family, healthcare clinics, those other providers across all of California, how are we making sure that the vaccines from an allocation perspective, so where those vaccines actually go, make their way in the most meaningful numbers to those that are most disadvantaged so that the supply is there when they're ready for it. How are we making sure that we're overcoming barriers like language access, right? So many of our communities, particularly those in the Latino community, even speak indigenous languages, right? That make it difficult to understand processes. And so how can we overcome that? By really bringing community partners to the table to make those spaces not only inviting, but also in a way that helps those individuals feel more comfortable, right? There's enough to worry about, as both of the doctors pointed out. What are those side effects? How am I going to feel? What's it going to do? Is it going to impact my fertility? There's so many questions and pieces of misinformation, unfortunately, still out there. So we really want to get to the root of some of those questions and make sure we get them answered. And last but not least, really using data as the underpinnings for all of our outreach activities, and making sure that as we learn how people are reacting to, not only the vaccine itself, but understanding these systems, that we can really address continued barriers or access concerns that might also crop up, right, over time. We know these sorts of long-term processes, we're going to keep learning and getting better. So Julian, a little bit about what the state is doing and what our campaign is doing to make sure that all Californians get access to the vaccine.
And I'm really glad that we have both Dr. Cruz and Dr. Shapiro. In your experience, Sonia kind of went through what the state's doing and what we need to do to get to those communities. But in your experience, I mean, in trying to provide services to these communities, to our communities, to our disadvantaged communities, to our seniors, what can our business leaders do and our communities leaders do to help, alleviate maybe some of their concerns, and make sure that they do get access or gain the proper access from your guys'
Julian, I'm going to take this one, and I'm going to volunteer myself and Dr. Cruz and our groups that we have from Vacúnate Ya, the Latino Action Group, and a lot of other groups that we have is, por favor, invítenos a platicar con su gente. Please invite us to talk with your people. We need to be in front. We are here. We have the information here. In most importantly, here in our heart. We need to hear that a couple of things. If you're fearful, a lot of people were like, oh my God, you have fear. You don't believe in science. No. Fear has saved us for many years, many thousands of years. If we had a dinosaur behind us, that's fear. We run faster. Then fear is okay to have. We need to acknowledge that part. And second thing is that we need to be fearful for real stuff, not things that can be saved by information or by science. And we already have data that, everything that we're doing is safe and it's protecting our communities, to the point that California is actually leading the entire US country on the things that we're doing as for businesses opening and creating a new future of everything. Then we're understanding that part, and we need to be your partner. That's the important thing. We are here. It's on the old days, it was like about access of information. Right now, we are here. We actually need just the outputs. And please feel to contact us. We are here completely to help each of you. We don't have an excuse. We are sitting here. I can do a webinar in the entire country like the one that we're doing right now, and for 30 minutes, and we can actually replay it afterwards. Then we can do that. Y lo podemos también hacer en español y en otros idiomas más. We can actually do it in Spanish and other languages at the same time. Y otra cosa muy importante, one very, very important thing, our essential workers need the opportunity to get vaccinated. That's extremely important for absolutely everywhere that we have. We are hearing a lot of the community members that they really want to get vaccinated, but they don't have the opportunity to do so because, like the flexibility with work, with other stuff. Then making a plan for everybody that works on your businesses, and making sure that, there's right now mobile units, there's centers, there's churches that are actually doing open vaccination stuff. Then coordinating that type of things, it creates a couple of things. One is that it's a correct thing to do. Two, you're opening your heart to the community. And three, you're solving a couple of things. We're actually creating the pathway and opening the doors for the things that we want. We want to go to a restaurant. We want to buy things. We want to create a lot of things. We want to have services. And one of the best tools that we have right now is the vaccine.
I can't say it any better than what Dr. Shapiro just said. The only thing I would add is that, just to reemphasize, is for the members of the chamber, trust the science. Also, to please engage trusted messengers like Dr. Shapiro, like Dr. Harris, and most of all, to please, as Dr. Shapiro said, provide your workers, your workforce, the flexibility to receive the vaccine. And also, for the time being, this is a quite fluid situation, they still, adhere to the guidelines of wearing a mask, maintaining social distance, washing hands frequently. Those very important, yet very simple public health guidelines, recommendations are really important to continue to follow. It is not a political issue. It's a public health, medical science issue. Viruses don't care if you're a Democrat or a Republican. They do not care if you're rich or poor, if you're educated, monolingual, trilingual. It has no preference. It's an equal opportunity disaster. Viruses are.
Thank you. Yeah. So let me, as we're trying to educate people on, there's a lot of news on, approval of, I know that now I think it's going to be 12 and older on the Pfizer. They're waiting for approval there. But let's talk a little bit about the Johnson & Johnson. There's a lot of, concern on the Johnson & Johnson vaccine, and really just educate, the audience on what happened and that it is safe, because they have ruled that, it's safe and there are going to be incidences, et cetera. So I guess to our medical team, again, a little bit of expansion on the Johnson & Johnson issues that have come up.
Well, I'll just say, all three vaccines are safe, are effective, and they're free. I mean, that's really what folks really need to understand. The Johnson & Johnson, as does happen with any medication we take, whether it be for high blood pressure, for diabetes, for a sore throat, for any kind of medication, there are rare instances of a adverse problem. In this case, it was a very uncommon blood clot formation. And so I think the important message is that the government took an abundance of safety, a high level of safety, and said, let's put a pause on using the Johnson & Johnson vaccine. Let's study the data once again, more closely, more deeply, before we make a decision. So, in which they have, and they've declared that after looking at the data that's available and studying it very deeply, very meticulously, they said this occurrence is, you have a higher likelihood. I mean, they didn't say this. This is basically what it boils down to, is that you're more likely to be struck by lightning than you are to experience the blood clot from Johnson & Johnson vaccine. So I think, again, that all three vaccines, safe, effective, and free.
I feel like Dr. Cruz, you couldn't have been a better testimonial there for our campaign. And Julian, just want to add to, from the department's perspective, really, this was our system hard at work, right? The doctors saw something in the data that was interesting, as Dr. Cruz mentioned, severe yet very rare, and process and sort of the procedures at the federal level intervened. But also here in California, we have an extra layer. So we have our Western State Scientific Advisory Panel, which is made up of doctors from all over the West Coast. The governor implemented this late last year, really as sort of a check and balance, an extra, third set of eyes, if you will, to help keep Californians safe. And so once the national body, through the Federal Drug Administration did review all of those data points, as Dr. Cruz mentioned, our doctors and scientists did the same and concurred with their recommendation. So just, a couple extra pieces, when we talk about safety of all 3 vaccines, they are indeed all safe for Californians. And the extra step that we took is we are asking providers that if those that choose to get that Johnson & Johnson vaccine, they walk away with something that says, hey, be on the lookout for these very rare side effects. So if you do see them, make sure you get in touch with your doctor, right? Again, really making sure that our processes are strong across California to uphold public health and safety.
Dr. Shapiro, anything to add?
It's awesome. It's real. We have a vaccine that actually saves lives. It's protecting our community. It's one shot and you're over with it. And the thing that, a lot of people, and I want to add the only piece of information that I think that everybody needs to know, that because it's one shot, it doesn't mean that it's less effective. Because it's one shot, it doesn't mean that will protect you less. Actually, the beautiful part of Moderna, Pfizer, and Johnson & Johnson is that 3 of them can save your life and actually prevent you from going to the hospital. Then, the 3 of them are very effective. And by the way, we're businessmen all over here, right? We are in this commerce forum. And I want to share a couple of numbers. Possibility of getting a clot because of the vaccine with Johnson & Johnson is 0.00 something. Possibility of getting clots because of COVID-19, 16%. That means that you have 10,000 times plus opportunity to getting clots just for getting sick than anything else. And that's the numbers of risk management that we need to be thinking of. And that's why the opportunity to get vaccinated that we have here in the US, especially here in California, is so important.
Sonia, you hinted that, California has another layer with the Western Health group that looks at the vaccine. But I think a lot of people don't realize that there are a lot of controls that have been put in place to protect Californians or anybody, right? I remember a doctor saying, hey, we can give the shots. I mean, that's quick. What it is all the paperwork and documentation we have to take to make sure we hit these standards, right? And that we're protecting the patients. So again, I'm glad you pointed that out. But is there anything you guys want to add to the protection, in regards to the patient and to the individual that's put in place here, from the beginning to the end, to the time they get the shot? I mean, it's not just come and get the shot and leave. I forget who the doctor, but he was saying he was enjoying giving the shots, right? He says, but man, the paperwork part of it, he goes, that's what takes us a while. That's why it takes 15, 20 minutes to get a shot. But anything to add on that, on the protections that you guys have all put in place and that you guys watch, in addition to what you've said?
Well, actually, if you put the number, and again, we love numbers, right? Finding out 15 cases out of almost 7 million people that apply the vaccine, that means that they are looking into this. And that's why I had a conversation with one of my coworkers, and they went like, Dr. Shapiro, have you heard about Johnson & Johnson? I say, what? It's horrible. Like, no, I'm very happy. Like, Dr. Shapiro, well, yes, the systems are in place that they can actually see from 7 million people across the country. They can actually identify 15 cases. And not only that, they can react and tell us, let's wait, let's analyze, let's put everything together, let's see if we have more cases. And that's the safety measures that I have. I feel secure, safe, to the point that I got my vaccine. I think that that's the way to go. And I did it for myself, for my family, and most importantly, for my community.
Yeah, I just have to share, like Dr. Shapiro, I had my vaccine, I had the Pfizer in February, and at the end of February, and not only was it no more discomforting or discomfortable than getting a tetanus shot or when I've had to get any other kind of vaccination, but the peace of mind was tremendous.
Yeah.
To know that, I was, and folks in my household also were vaccinated, being able to get vaccinated. So the peace of mind for all of us that we could mingle with each other at home and have that sense of security and safety was, I couldn't, I'd pay $1 million to have that sense of security. Fortunately, the vaccine was free.
Well, I had the Pfizer as well, Dr. Cruz, and telling someone that, you hear about people having different reactions, right? I'm tired, or I can't get up in the morning, and got to sleep it off. But I had no reaction. I was fortunate, I guess. I had no reaction other than a little soreness in the arm. But I was thinking about it and said I've had worse reactions just from a regular flu shot than what I had, And I know
Yes.
it affects people differently, but I just say that because I think, again, people also get fearful because they hear of some of those side effects, right? And they say, "Oh, I don't know if I want to do that," or and I know a lot of friends that all they did was said, one day I was just tired, and so I slept it off, right? What are some of the normal side effects and that people maybe experience that you guys have heard? I know, Sonia, you've probably heard them from the work you guys have done, but Dr. Cruz and Dr. Shapiro, I mean, I had a little bit of soreness in the arm, I hear that some people get just tired. I heard people say, hey, my joints were just aching. So what are some of the other ones that maybe we don't hear about that aren't alarming, but it just happens? And I think, I don't know, you tell me, you guys are the doctors, but it sounds like, people react differently to it. It just depends. So.
Well, maybe I'd offer as a contrast what an individual might experience if they don't get vaccinated. And I'll use my father as an example. My dad is 81 years old. He was a retired state worker, state of California, worked for actually Department of Healthcare Services as in the Office of Civil Rights. So he retired about close to 15 years ago. He lives in Bakersfield, went to a restaurant for Father's Day. And this was, and within 2 weeks, that's the only thing that he did. He was following all protocols, except they had not closed down restaurants or anything like that at that time in Father's Day, June of last year. 2 weeks later, began to experience respiratory symptoms. He was having difficulty with his cognition, thinking, became unsteady, and wound up going to the hospital, being taken by paramedics to the hospital. He was at the hospital in Bakersfield for 7 weeks. For 7 weeks, he was in the hospital, could not have any visitors. We had to talk to him through a laptop. I'd say about a week into his hospitalization, my dad called us, and with his mask on, he had to wear a mask, an oxygen mask, because he was not doing well with his breathing. And he said, "Mijo, I'm dying." And that was the most difficult thing to hear, and not to be able to be at his bedside. And I said, he was there for a prolonged period of time. thankfully, it took after about 5 weeks, he finally began to turn a corner. But he had also been debilitated for the prolonged stay. He had to go for another 4 weeks for rehab to build up his strength again. So he's been back home, since August, and he's experiencing brain fog, and he's still not fully physically where he was before the infection. So that's the side effect of not getting the vaccine. Now, by comparison, like I said, sore arm, low-grade fever, or you just feel warm. Maybe you just feel a bit sort of just, I don't know, under the weather. I would choose that any day.
Yeah. No, definitely. It's a fantastic story. I've been, like you said, it's a sense of mind, right? And, having that comfort, knowing that, like you said, you can see family again in some limited instances, but, just like you, my dad luckily did not get sick, but, we sequestered him for almost a year, right? And he didn't, and, it came down around Christmas and we got together a little bit, but, he was still saying no, and so it's like the first Christmas without my dad, right?
Yeah.
But, he got in that first group, got vaccinated, and, we had a little get together this last weekend, and he was there, right? He was able to see the family but, I think people don't realize, and I know we have a lot of people out there maybe haven't been impacted, and a lot of those are the naysayers saying, oh, I don't need to get vaccinated. But I think many more of us have been impacted by family, friends, or loved ones that have been either, have passed away or have had COVID in some form, So, again, I think I'm just trying to figure out, how do we, I guess it's just education. And I think it's, great minds like yourselves and Dr. Shapiro and people like Sonia out there just trying to educate the community. But I mean, I guess the big question for some of our leaders is how do we do that, right? Because this is, from a business perspective, this is important to the economy for us, right? We don't want to see a third shutdown come around, right? I think we can all agree that would just be devastating, a third go around. So I guess I'm leading up to the question about, you hear about herd immunity. So maybe a little bit more what it is, how do we get there, and when do we know that we're there?
It's the lucky number that we're looking in order to create a barrier between us and everybody else. And by the way, I am advocating to change that term probably to like community barrier or something like that, because it's when you herd immunity, like, we were cows way back then and I don't see the pathway and stuff like that. But one of the important things that we need to understand is that COVID-19 actually uses humans as the only industry, factory, business to replicate. Then whenever it comes to us, it needs us to replicate. Then yes, it uses our cells, creates more viruses, jumps to another person. Has three options. One is the first part is actually, it has so many errors and stops working. The second one, it can mutate and be more, more aggressive and kill more people. Thanks God it hasn't happened. Or the thing that it's happening right now, it actually can jump faster from one person to another. Saying the three options, when we actually take out or we create barriers, community barriers between us and the virus, and that's why it was so important at the beginning, the part of, social distancing, washing our hands, the mask, because that's the tools that we actually had. Right now with the COVID-19 vaccine, we teach our body to be on the lookout, to make sure that we have those laser missiles at the moment that actually they see the virus and attacks. What's the difference? The virus can actually go inside, but our body actually reacts without reproducing or replicating a lot of the virus. And that way it doesn't jump to another person. then the more people that we already have those missiles, those antibodies ready to be shooting at, you cut in half the opportunity of this virus to jump from one person to another. Then and it will go to a point that the more people actually have that immunity, we're protecting ourselves. And most important, right now we know that we still do not have a lot of vaccines for kids because they are on the pipeline and they're like being approved, and they're doing the research of that part to figure out what's the dosage for them. And right now, the important thing that we have, and there will be people that have cancer, autoimmune diseases, and other stuff. They can, like their body will, you can put all the vaccines that they can have, but they will not create antibodies. Then we need to protect all of us in order to do this. Plus, another one that is very important to make sure that we're cutting this jumping of the virus is that every time that it jumps, it can mutate. I already told you about that. Then if we want to have surprises on the long term and have a special virus that doesn't, doesn't behave well, and our vaccines, they're our special armament that we have right now to punch the COVID on the face, they can stop working. Then the faster we and quickly we actually vaccinate everybody, and we create this actually social barriers, community barriers between us and the virus, we'll have a better future. And it will be important for the businesses, schools, hospitals, doctors. Trust me, I love my patients, but I love to talk about vaccines. I love to talk about development. I want to talk about diabetes, obesity, the other stuff. And I want to move forward and create a better future for myself and my kids. And the only way that I see right now to actually create that community barrier, that community shield, is actually the vaccine.
Let me ask this question. I guess everybody's interested in what are our current numbers? And I guess, Sonia, maybe you can answer some of it, and the doctors I'm sure can. But what are our current numbers, and where do you guys see it going? Is it continue on a downward trend? And is that basically due to the vaccinations that are happening?
As both doctors mentioned, Julian, we all love numbers. So I'm assuming you mean our positivity rate.
Yeah, I guess it's.
Yeah. Our daily average is well under 2%, and it has been for several weeks now. So I think this is where Dr. Cruz talking about all of those good practices that we've really been normalizing, right? Making sure that we wear masks when we're in public to stop the spread, making sure we distance, making sure we wash our hands. So that's one piece, right? Californians really stepping up in that way. But then obviously vaccines, we've seen some positive movement there, but by no means are where we need to be with that building of a community barrier. Dr. Shapiro, I love that. So we've still got to stay focused and keep going, right? Because if we don't stay vigilant and really, take this opportunity that's being afforded to us to protect ourselves and our family, very quickly we'll be able to slide backwards, right? There are other places in the world that unfortunately are not in the same place that the U.S. is, or that California. And so, continuing to stay focused on that end game, right? That last goal that we need to make to win the soccer game, or whatever it may be, whatever analogy pleases you, we really need to stay hyper-focused there.
Yeah, Julian, and it's just real important that, we've had great success. Kudos to Governor Newsom and his, team of experts and advocates to get out, not only distribute the virus, but also come up with a plan on how to maintain our safety while we're going through this experience. But there's still a lot of work to do. There still is. We still have areas, there are pockets, even though overall statewide it's improving, there are still pockets where individuals have not had as much access to the vaccine as we would like. So we're working to get them access to it. There are individuals, as you mentioned, Julian, that are, what is it going to take to get them to decide to get the vaccine? and some of it is education, some of it is beginning to talk about what do we value as a community, what do we value as a society. And it's not a win or lose. Either if you get the vaccine, I lose as a businessman. We lose, so can't we just open up and everything? It's not a zero-sum game. This is, in order to have an economy, you have to value public health. In order to have a healthy workforce, you have to value and support the public health measures. In order to have a customer, you have to value public health. And so that's the key, thing is we have to move, again, as we said, this virus, it's an equal opportunity destroyer of lives. It doesn't care if you're a small businessman or if you're a Fortune 500 business. This virus will destroy your business if you don't take these proven, medically, scientifically developed, studied precautions and put them in place. Dr. Fauci said it very, very well. He still says it. We could have avoided the second and third surge if we had listened to him at the very beginning, back in March, April of last year. If we had the wisdom to listen to the science and put it in place, not question it, not debate it, not mock it, but to trust it and value it, we would not have had a second, third, hopefully not a fourth, fifth, or whatever wave. I mean, let's learn from sadly, let's learn from our brothers and sisters in India who are going through a horrendous fire, this human fire that they're going through right now. So let's learn from that and trust the science.
And I would like to add something from Dr. Cruz, that there's no fight here. We're, at the end of the day, we're humans. And I love how the perspective of Dr. Cruz, that it doesn't distinguish anything. And I'm going to quote you with equal destroyer of opportunities. And right now, I hope that we learn right now from each other, from the past almost year that we have passed, and most importantly, how are we going to create as a private sector with that holding hand with the public sector, on how we are going to create resilient communities. There's a lot of talk of this, and we have seen in our community, it was not a miracle that this virus chose our community, not for the infection rates, but actually the problem that we had with mortality, complications, hospitals. I still remember January and February of 2000, of this year, where a lot of most of the ICUs in LA County were from people of color. Reality. And it's not because this is actually a virus that is, genetically modified to destroy. No. It's very simple. It's decades of problems with social determinants of health, lack of access to healthy foods, a lot of problems with green areas and other stuff that we all together can make a huge difference. Why? And I'm going to do a spoiler alert right now for everybody else. We will have more pandemics. The question is, are we going to learn from H1N1 2009, from COVID-19 2020, and choose another number, 2025, 30, whatever? Are we going to have the same outcomes? We're going to struggle. We're going to do the same exercise, but are we going to lose so many brothers and sisters because of this? Or we're going to, yes, have a debate, and we're going to come up and continue fighting. And that's I think where a lot of this conversation, I hope that it turns. And we know right now that we were looking for a miracle, for something, a way back to fight against COVID-19. We already have it. It's called vaccines. Then we need to move forward.
Let me ask, I'm going to ask one more question, and the studio tells me we have some questions that have been sent in online. But you guys, the last few comments, you've kind of segued into this question. The governor, mayors, elected officials, doctors, county public health officials have had to make some difficult and tough decisions that haven't been liked by many, right? But we are, kind of seeing the light at the end of the tunnel, as people say. I guess my question is what do business leaders, community leaders who are online now, and community leaders online, what do we need to do to assist these efforts on the California public health side for vaccine 58, and just to end, get through this pandemic? I guess I'll talk with Sonia. What do we as business leaders, community leaders need to do? And I've been preaching that, we've got to lead, right? And if we're going to get past this, we all have to be leaders and do our part to help, get the economy going back, open up California. So I'll go to Sonia first.
Oh, thank you, Julian. If there's anything about me, it's that I love to give people homework assignments and help them help others. And so, at the end of the day, Sacramento, we can, I sort of say that with air quotes, right? Sacramento can say all we want, right? We can send all the messages. We can, put all the public service announcements in the air waves and on radio and on TV. But at the end of the day, each of you all are leaders in your community, as Julian mentions. So many of you are the heartbeat of these communities, really making them vibrant, either as an employer, making sure that those families have the means to do what they want, to live their best California life. So many of you contribute to community events, which I know have been hard, especially in the last year, likely with sales and so many things being impacted because of those tough decisions that Julian mentioned. But really nothing substitutes for what even the doctor said today, right? What was their own personal experience? It wasn't that bad, right? It was less than 24 hours of maybe a sore arm or feeling a little under the weather. Reminding folks that it's safe and free, and that you don't have to worry about your information being shared. We know there are so many concerns and distrust of government. And so to have folks from the business community, right, those that have really earned every moment of their success, talk about the safety of the vaccine and the fact that you don't have to be afraid that your information is going to be, shared with any enforcement entity or anything. Those messages go the longest, right? We know that people want to hear from their doctors or their friends. And so, we've got lots of tools. I would be remiss not to plug all that we have. We've got toolkits, and Julian, we can make sure that you have all of those links, but super easy things to put on your social media platforms. We know everyone's hungry for content that's fun and fresh. Or leaving flyers in your business, just to really spark some of that conversation, and lead with empathy. When we talk about putting things into our body, these are tough decisions, right? I just got done trying to convince people to fill out 10 questions on a form so that we got, $10,000 per human back to California. That was an easy task. It feels like now when we talk about folks making that personal decision to get that vaccine. So, whichever vaccine of choice. And so those are just a few reflections, Julian, on how our business owners can start today, can help us get closer to that community barrier, that what we need to be safe as we look to a brighter and open California.
And the website they can go to for public health?
Of course, it's vaccinateall58.com. And there we've got links to toolkits and resources, to our online booking system, My Turn. And last but not least, we've got a hotline. So if folks want to book their appointment or have questions, there's a hotline you can refer folks to, and we offer that in over 250 languages. So everyone can get their questions answered, even if they can't find it online and they need a little extra love from someone on the other line.
Dr. Shapiro, what else can we do to help?
We need to do something very important, and this is, extremely hard to do. Do not spread misinformation. If you get something in your cell phone that it's horrible and you go like, it sounds weird. If you get that red flag in your brain, don't spread it around. We need your help with this. You can be a COVID-19 fighter if you just don't spread things in WhatsApp, in Messenger, in Facebook. If you have a doubt, please, I promise you, and send me information. It's at @dr_shaps, Instagram, Twitter. Send me your questions. I promise you, I will work with Dr. Harris and Dr. Cruz to debunk absolutely everything that you have in your hands, to make sure that if it's real or not. And that's one of the things that it's the most important thing that we have. We are fearful of a lot of things. This is the moment that we need to start shifting everything, and we need to start vaccinating our communities against fear with a dose of truth. We are already suffering with the virus, and it has killed a lot of people. Right now, we have the solution. Are we going to poison our brains, our hearts, and our souls with misinformation? That's up to us. It's not a scientific thing. It's up to everybody else. You don't need a PhD or be advanced anything. You just don't send it. Click, simple.
And as Dr. Shapiro said, at Dr._SHAPS, Shaps, and he'll answer your questions. And Dr. Cruz.
Well, I just want to reinforce everything that Sonia has said, that Dr. Shapiro has said, and the only thing I would just add is for the business community to look at people like Sonia and Dr. Shapiro and myself. We're your partners. We're in this with you. We're not here to dismiss or negate what you do as a business person, as a businessman, business owner, businesswoman. As Sonia said, we recognize, we acknowledge you are vital to the communities where you live and where your business is located, or businesses are located. I said, so we're your partner. We can't do this without you. We can't reopen California without you, but we really need, we hope, we trust, I beg, look at us as your partner. Ask us to help you. If you don't get the science, if you're not sure, ask us. That's my whole life has been, from cradle till now, has been about the science. My 61 years has been about the science and treating diseases and caring for the very people that work for you or shop or use your business services. So I'm here with you. Just let us in and we'll work together.
Great. And is there a website? I know Blue Shield's partnering with the state on the distribution and stuff, but is there a website that Blue Shield has?
On our general website, I guess blueshieldofcalifornia.com. Okay. We have a host of information and other areas to look at, and the commercials are pretty cool also. So
yeah, we saw a few of those just before we came on. That's great. Well, I'm gonna turn it over to the studio. I think they have some questions for us, for you guys. So, studio.
I'd like to read this in Spanish, and this is from Rosa Hernandez. Algunas personas dicen que después de la vacuna se olvidan más frecuentemente de las cosas. ¿Es las vacunas están afectando nuestra memoria? And let me translate that in English for those of us that they're not Spanish speakers. Some people say after the vaccines that they forget more frequently. Do the vaccine affect the memory?
Well, I'll answer, and Dr. Shapiro, I was wondering if you want to add anything. Well, I'll say this: we do know for sure that COVID-19 infection does cause problem with memory. Let's call it sort of a brain fog. We do know that. That, in terms of the vaccine causing that, I am not sure if that, we're still collecting a lot of data on the vaccine about questions or concerns about that type of thing, whether it be with memory or with fertility, and those kinds of concerns. There's still data being collected, but at least as far as what I have read and what I have observed and seen, I don't believe there is a connection between the vaccine and memory, changes in memory. So that Dr. Shapiro, looks like, would you mind sharing a double thumbs up?
Yeah, it hasn't been something that has projected in a lot of the data that I have been reviewing for, for learning opportunities in our body or side effects. It's not something that has appeared there. Then I can share my own experience. I felt tired. I slept like a baby. I think nobody's actually saying that and acknowledging that, and we need to be happy about that part. I slept very well twice, and that was about it. But not until now about the memory. But I will gladly share with Julian, any information that may can appear or something like that. But I'm almost very certain that that's not some of the highlighted side effects from the vaccine.
Next question.
Dr. Shapiro and Dr. Cruz, can you elaborate more regarding the safety of vaccines, long-term side effects, things the public is hearing that scares them from getting vaccinated?
Dr. Cruz, I can take the first hit over here. There's a lot of debate, and I have been in a couple of interesting conversations online on how do you know that long-term effects are not there. Well, on reality, because it's the entire technology that we have, I'm going to divide it into two things. The quick answer is, do we know 100%? No, we do not know. We do not know what's happening with aspirin, Tylenol, and other stuff that we have around us on the long-term side effects. It's an ongoing process, and that's why we are checking it. That way, we're putting all the safe and safety integrated systems to make sure that if something happens, we are the first ones to know. But the technology that we're using right now for Moderna and Pfizer, and the other hand, Johnson & Johnson, we have already used it in many other diseases and other problematic pathologies in medicine. Then we already know that we have a couple of years of using this type of technology, and we haven't seen anything long-term that will make us be worried. Specifically for the RMNA vaccines, Pfizer and Moderna, the components of this thing that is practically like instructions for our cells, it gets destroyed in hours. Then it's not that it's leaving a footprint inside of us, that it's changing our DNA or anything. There's really no reason why to think that something long-term will be affecting us with one of these three shots. And for example, the other vaccine that we use, Johnson & Johnson, uses the same technology that we're using against Ebola and other diseases. Then it's very safe, effective, and actually creates really good long-term immunity and protection for the people that actually got it. And I want to tell you how sure the knowledge that we have and how sure I feel about these vaccines. You already heard that I have two kids. I'm a pediatrician, also a father. husband, human being, and I'm just waiting for the opportunity to get the FDA approval for the vaccines to get my kids vaccinated. Why? Because I think that it's the safest bet that we have right now. And again, we're talking about numbers. I think that my safest bet to protect myself, my community, my family is using these vaccines, understanding that there's a lot of uncertainty. There is. We need to acknowledge that there's a lot of things. It's the first time that we're playing around with COVID-19. First time. Then maybe next year we'll know that certain vaccine is better for pregnant women, the other one is better for little kids. We'll have more data next year. Right now, with the information that we have, the smartest thing that I know that we have in the plate is to get vaccinated. And I hope that I answer the question there.
Yeah, I would just add to everything that what Dr. Shabeto said. I agree with completely. And in terms of long-term effects, as he said, we don't know because long-term hasn't come yet. We've only had these vaccines at less than a year. So, and I do trust the science. I do know, I have confidence, and I do know what's happening. They're going to collect data about the use of these vaccines for next year and the year after and the year after and decades after. Like any medication, we may not see any effects at all. There are some things that we don't see effects until 50, 60 years from now. As an example, certain people who worked in building our Navy ships used asbestos as part of the protection, the fire protection on a Navy ship during World War II. And it was not until decades later that we find out that asbestos, the thing that we thought was great, actually causes lung cancers. 50 years or more later for something that wasn't even a medicine. So, we just have to be patient. And lastly is also think of, kind of weigh on your hand sort of the risk of not getting vaccinated versus the benefit of getting vaccinated. As I mentioned, the side effects of COVID-19 are incredibly severe compared to the things that we're experiencing from a side effect of a vaccine now. So be patient. Long-term hasn't happened yet. I think things are going to be okay.
So sorry. Yes. And next question. Can the vaccine cause any infertility issues?
Yes, Dr. Shapiro is exactly right. The vaccine, based on in fact, there was a recent article published in the American Journal of Obstetrics and Gynecology, and looked at Harvard Medical School, looked at the data of individuals that had been receiving the vaccine or part of clinical trials in ladies, and there were no instances of fertility being interrupted or interfered with from the vaccine. Several women who were part of that data did get pregnant, and also there's no evidence that the vaccine causes any harm to the fetus or baby. In fact, the data seems to show, because we do know that the mother's antibodies will get passed in breast milk, those antibodies that the mother has formed against COVID will pass through the breast milk to the baby and help the baby's immune system and protect the baby as well. So it's kind of for women in fertility, it's a twofer. You get protected and your baby gets protected. And no hindrance, impact on fertility.
And Dr. Cruz just weighing in there, and this will be a little bit of a surprise to Julian. The study that you reference was actually the thing that helped me go from cautious to getting the vaccine. I found out late last year that I'll be having a daughter in July. Yeah. So that's the news, Julian. And one of the things I was so nervous about is, hearing that the trials didn't include pregnant women, that there's a handful of women, that obviously had gotten pregnant sort of through the process, but that sort of data point didn't exist for me to understand and digest and so on and so forth. And luckily, while I'm not a doctor, I get to be surrounded with them at the Department of Public Health, and our chief epidemiologist, Dr. Pon, took some time with me just to talk through the study that you mentioned and really understanding where vaccines, particularly in whooping cough and in the flu, transfer, from the mother to the baby in the form of antibodies. And when, she said, if I were pregnant again, I would not take a chance. I would get it. You should really consider it. And to your point, the fact that, I might be able to help protect my baby in her first few months, when who knows what, COVID will still look like at the end of this year. That was really a tipping point to push me over the edge and get my first and second dose of Moderna. And so so grateful for the science, that continues to be published and that we continue to learn. Yeah.
Well, congratulations, Sonia, and tell your congratulations as well.
And as a pediatrician, you know where to find me. You already have my cell phone and everything. Then
only if you do that. Have you seen on YouTube, what is it, the doctors that play with the babies and they don't even know that they got the shot? It's just incredible. I'm signing up, Dr. Shapiro. I'm coming to you.
We got another question there?
And next question. I read an article this morning that the Biden administration was going to prioritize vaccine distribution to states that show higher demand. How will this affect low-income communities, and will the efforts against vaccine hesitancy be impacted by this?
I think this might be fresh off the presses, but happy just to weigh in, on what I know very briefly. As I understand, the nuance in that announcement from our White House really had to do with unordered supply, right? So each state gets a specific allocation from the federal government, and then states are able to order against that. And so it actually allows, places that may not have ordered for those to be redistributed to other parts of the U.S. So, I see this along with the work of our trusted messengers, you all. If we can continue to have, good uptake rates in California, that this is really exciting news for us, that we're going from sort of supply limitations, right, to more supply abundance, and that becomes an opportunity for us here, as long as we drive those trusted messengers down to those that have yet to get their vaccine.
Well, I think that was the last. Oh, I want to close with this question. So I know we're trying to get people vaccinated, but how long, and so for all three of you, how long do you guys estimate that people will have to continue to wear masks?
I can tell you, you know what? I'm going to not tell you the truth, but I'm going to tell you what we're looking for. Let me tell you why. We need to align a couple of things. And this is what we need to be watching for on the numbers, on the trends, and on the vaccines. Factors that we check for is that how many people are getting sick, how many new cases we're having. That actually needs to go lower. For the other side, how many people are getting vaccinated, the thing that we were talking about, the herd immunity, community shield, that's the other thing, how many people are actually getting vaccinated. And the third thing is, how are we doing with the mutation of the virus? Are we having new we right now we have the Brazilian one, we have the California one, we have the South African one, the UK one, and the original one, and the W mutation that we're talking about in India. Then we have a couple of them cooking there. Then if our shots are still effective against them, then if those three things are happening, those are the signals to have a green light and throw away our mask away. That's where we are going towards. When will that happen? Well, it depends on us. It's a direct relationship with us. The vaccines are there. We're getting, thanks God, to a problem that we have too much vaccines and not too many shoulders. And we need to remember that the vaccines do not work if they are in a fridge. They need to be on a shoulder. Then we need to start putting them there. Then that's the things that the three things that we need to be pushing forward.
Yeah, that's exactly right. There is no mathematical formula of, if we do this, this, and this, then this equals, the stop the mask. There's these situations, the numbers have to come in to support each of those three things that Dr. Shapiro says, and then we can figure it out. So it's not a predetermined formula. It's like we have to kind of see where each of these are, look at the data, and said, okay, we have to make a decision and trust the scientists, the medical scientists, the epidemiologists, the consummate experts on how to look at the data and analyze it and say, here's where we're at. This is what we should do. And then trust their guidance and follow it.
And Julian, I'm going to take the one thing I learned. I'm not going to spread misinformation, and I'm certainly not going to bet on the life of any Californian. So I think too early and time will tell.
Okay. Well, great. Well, thank you, Dr. Shapiro. Thank you, Dr. Cruz. And thank you, Sonia, for being with us this morning and educating our community and our leaders in the state so they can be better informed and help us all, put an end and come to an end on this COVID-19. But I think, everybody has to play a part. And with that, I'll turn it back over to the studio.
Thank you, everyone, for joining us this morning. As a reminder, please join us tomorrow, Wednesday, May 5th, 2021, for our California Business Policy Summit from 9 a.m. to 12:30 p.m. To register, please click on the banner at www.cahcc.com. For our small business owners and your extended networks, please join the CHCC and the California District Offices of the Small Business Administration, and that's SBA, for an informational webinar on Thursday, May 6th, 2021 at 3 p.m. to access key resources and information pertaining to the Restaurant Revitalization Fund a $28.6 billion program that provides funding for restaurants to meet payroll, purchase supplies, and transition to today's COVID-restricted marketplace. To register, please click on the banner at www.cahcc.com. Again, to register, please go to www.cahcc.com. If you should have any questions, please email info@cahcc.com or dial 916-444-2221. That's 916-444-2221. Again, thank you so much and have a great day.